I am Dr. Brad with Hope Clinic. Hope Clinic, what we are is we're a multidisciplinary clinic that we specialize in multiple specialists and specialties. That's what makes us unique. The whole goal is if we have a lot of expert opinions or we get a lot of options. So that just kind of shows the 6 diagnostic disciplines that we actually consider when we see patients. We're the only clinic I know of that does that. Today, we're going to talk about an option called CNSR. CNSR therapy stands for Central Nervous System Restoration. The doc I actually trained under, he's the one that actually coined that term, which we'll talk about in a little bit. So the whole point of the cranium is I've trained in numerous cranial techniques, and they all are based on what we call the sphenoid bone. The sphenoid bone is this butterfly-looking bone through the middle of the skull. If you touch your temples, you're touching the edges of your sphenoid bone. And if your cranium collapses in, if it kind of locks up, tightens up, and collapses in, the sphenoid bone gets compressed and twisted. And so every cranial technique out there that I know of is focused on how do we decompress and untwist the sphenoid bone here. So what we're trying to do is get it back to where it originally is. All right. If it is compressed, if your cranium's compressed in, we're talking millimeters, what that can do is that can inhibit the cerebrospinal fluid and the central nervous system of your brain and spinal cord. It can affect your sinuses, your jaw, your neck, hormones. It can cause headaches, specifically what we call occipital neuralgia. It can affect your emotional brain, and it can even affect how your body heals in different ways. So we're going to talk about that a little bit more. So let's talk about the history. So CNSR, or what we call it a balloon therapy technique. They've been around, balloon therapy techniques, since the late 1920s. Back in the late 1920s, early 1930s, there were 3 doctors of osteopathy that came up with this idea of they were trying different ways to unlock the cranium and open up so your cerebral spinal fluid works like it's supposed to, and your central nervous system and brain actually works like it's supposed to. And they came up with some techniques where you go through the mouth. I'm trained in some of that. A lot of medical doctors can be trained in that too. But they came up with this idea of, hey, what if we use a finger cot, a medical finger cot on the end of a blood pressure cuff? And that's where what we call balloon therapy started. What they found was they could get around the gag reflex, because up to that point, everybody had tried to go through the mouth to get the sphenoid bone to move. And they found that if they used this balloon therapy, that cerebral spinal fluid, the fluid around your brain and going down your spinal cord, actually increased over the next about month's time. And so it was like a big deal, because that's what allows your brain to heal and your brain to communicate with other areas of your body. So the whole idea is, let's get that cranium to what we call unlock. That's what we'll talk about a lot. So then after those guys, we had Dr. Stover, who was an obstetrician. And he found that he trained in that balloon therapy type technique. And it was very helpful for when he gave birth to some kids, the moms would come back and say, hey, my kid has headaches. And it usually seemed to be the kids that were stuck in the birth canal a little too long. They commonly had headaches. So he would use this balloon therapy with them, and their headaches would tend to go away. So he started to think, hey, what if would it help the moms? So he started to use it for his moms before they had their kids. And he found that the moms that he did the balloon therapy with, they had shorter labor and smoother deliveries. The idea is, if you have a hydrated brain and you have a less tense, what we call dura mater, the dura mater is a lining inside your skull that goes all the way down your spinal column and actually kind of, in a sense, communicates with your tailbone. And if that's tight, then your pelvis doesn't move like it's supposed to. So during pregnancy, we want what's called proper nutation and counter mutation, and it seemed to affect that. So eventually what he did is he stopped doing obstetrics and focused just on this balloon therapy for 50 years. And so he spent a lot of time practicing and teaching and fine-tuning the training. that brings us to now. Nowadays, the doc I trained under, he actually trained under Dr. Howe. Dr. Howe's a doctor of naturopathy, and he's spent a lot of time with kind of the anatomy of how it works, more of a modern understanding of the cranial movement, and trying different exams and treatments techniques. The doc that I think made some of the biggest strides in this area is Dr. Horowitz. He was an anatomy professor at a prestigious college in the US. And I used to use his videos when I taught years ago on cranial movement. And he would show in the videos if you could just push on different areas of the skull, and even just a cadaver, so not even a living person, and you could actually watch the cerebral spinal fluid flowing through the tailbone and actual movement in the tailbone and sacrum, the base of your spine. So Dr. Horowitz, I trained, I did under his teachings for years before I ever heard of balloon therapy. Dr. Mccarty is the guy I actually directly trained under. I had tried balloon therapy with a number of patients through the years, different types of practitioners that use it. Never really saw profound results until I met Dr. Mccarty. And Dr. Mccarty, he's based out of Texas, and every patient I sent to him that made sense to fit, he got results with. And that's very rare in healthcare to be able to do that. So I decided some years ago, like, hey, he's the only doc I know doing this technique or getting results. I'm going to go down and see what he's doing. So I went down and saw what he's doing. And the uniqueness to his technique is this exam that he spent over 25 years working on. Because Dr. Mccarty, he's a chiropractor, and chiropractors are especially versed in how the jaw, the cranium, and the neck all function together. There's really no other type of doctor out there that's as versed in that as a chiropractor. But then he's also a board-eligible neurologist, so he has access to all the, we're talking 60 plus years of research in car crashes and how that affects the cranium with whiplash type injuries and movement injuries. So what he did is he applied that research and his knowledge to this exam. He's also trained in what we call applied kinesiology, what we sometimes call muscle testing. And he came up with this exam that has just been like gold. It just tells us exactly what to do and when. So he coined the term actually CNSR. And so he's nicely allowed me to use that term. As far as I know, I'm the only doctor that's trained under him, that there's just as far as I know, just the two of us doing this technique. So then comes me. After I trained with Dr. Mccarty a couple of years, I really I noticed some things that I noticed how he did the treatments. I have a very busy clinic. We're doing multiple disciplines, a lot of interdisciplinary work. I don't really have time to spend, all day just doing this technique. And so Dr. Mccarty used these body work techniques that worked very well. I needed to refine it down. So what I did is I refined the exam a little bit because I'm trained in what's called clinical kinesiology. There's a couple docs that came up with clinical kinesiology years ago that if you cross meridians in your hand in different ways and then do muscle testing, it actually focuses your brain's attention more on certain aspects. So what I do is I use the clinical kinesiology form, have the patient use that in order to localize just where the cranial sutures are locked up, tightened up, that kind of thing, so that we're not getting any other extra stuff in there. And that seems to have shortened up the treatments a little bit, like where we can get even more specific with his exam, although his exam is already very good. And then I trained in cross crawl and gait patterning for years. And so what we do is we use that to actually speed up the treatment. What we do is have people just take a walk to get that tailbone wiggling, and then that pumps the cerebral spinal fluid through. And instead of having to wait like a few hours to come back to do a second treatment that day, what we do is we can turn right around and check, hey, can we do another treatment? So it saves the patient a lot of money and saves them and me a lot of time. And it's been very effective. So what's the goal? The goal is to actually rehydrate the brain. Okay, so we have this layer of fluid around the brain called the cerebral spinal fluid, and that hydrates the brain, so it brings nourishment, oxygen, all that to the brain, gets rid of junk that's not supposed to be there, and then it actually goes down through the spinal column and hydrates your nerves going all through your body. If you have wet nerves, that means functional nerves and fast nerves. So we're trying to get this fluid moving. And we all have a part in our brain called the choroid plexus. It's this red area in the middle of your brain. And that actually makes cerebral spinal fluid. So if your cranium is collapsed, it's kind of like having a hydraulic system that only allows then for so much pressure of fluid to build up. And if we can unlock the cranium, get it a little more flexible, move it back out to more of a state of when we were younger, kind of like getting that internal helmet back, then that can allow for better function. The way I'll describe it a lot of times is, when we're really young, like babies and stuff, we have these big heads, the brains are still smaller, and we have a bunch of fluid around the brains. So it's like having a helmet inside your head. So babies and kids can bang their heads around or whatever, and it's not as big of a deal. As we get older, the brain actually dehydrates. In fact, that's what's been shown to be the same in conditions of memory loss, whether we're talking about dementia, Alzheimer's, or just memory loss as we get older. The one thing they all have in common is what we call a dehydrated brain, where we start to lose this fluid layer. So what we're trying to do with the CNSR is we're trying to build that back and get more fluid getting built. So what we do is we insert the medical finger cot up in the nasal passageway. There's 3 different passageways on each side of the nose we can go in, because we have these kind of what we call turbinates or concha in there that kind of allow for 3 different spaces on each side. And the exam tells us exactly where to go and what to do. And then what we do is we expand that, we call it balloon, but it's just a medical finger cot. And what you can feel during that time is some heavy pressure in that area of the face, in the nasal area and back behind there. Sometimes you'll even hear crackling sounds, like if the bones have actually overlapped and they move past each other, you might hear some of that. Sometimes you can feel it going into the throat. I'm pretty gentle and quick with it. So if I can catch it quick enough, sometimes people won't even feel that, but then sometimes you will. You'll just feel it in the back of your throat. You can lose your airway for 3 seconds, but it's literally 3 seconds. It's very quick. And when I did my training and I worked around other docs that do this kind of balloon therapy, I have been the quickest one I've seen. And that, I don't know, there's just disagreements whether to hold it or not. I don't think we need to. I seem to get results just fine doing it very quickly. So usually the patient will be like, oh, that's getting uncomfortable, and then it's done. So it's very quick. Afterwards, you can feel some achy teeth, achiness in your face. Sometimes your head might feel pressure in different areas because we're getting things to unlock and shift around. Your neck can feel different. My neck used to click for like a couple weeks after treatment. And then what was interesting is then I would forget about my neck, which I never used to be able to forget about my neck. It always bothered me. So that's been a huge help for me. So we're trying to get that fluid to flow better. So here's another view of this. We have our sphenoid bone through the middle of the skull here. It's twisted and compressed in. We have our nasal bones that are collapsed inward, narrow down nasal passageways. And then our palate is collapsed in and up, kind of tented up. And that was me when I was a kid. I had a narrow palate. They didn't know, the orthodontist didn't know what to do with my teeth. And they had to use it. I was one of the early kids in Minnesota to have an expander. Thankfully, my dentist knew about that. But then the CNSR is what solved it here as an adult way years later. So I was pushing 50 by the time I actually got what we call a class 1 bite. And CNSR did within seconds what orthodontists had tried for a decade with me. So what we're trying to do is we're trying to get that to decompress. So kind of something like that. Now, obviously that's exaggerated a bit. You're not going to walk out with a fat head, okay? But as you can see, what that does is that really expands space for breathing, for the sinuses that can drain better. I've had patients, including I was one of them, that their sinuses just hadn't drained for years, hadn't been able to. And this can just get them to open up and finally really drain. But it also opens up the cranial nerves to the face and that. I had some interesting cases. I've had multiple patients now that had what we call ptosis, where the eyelid is drooped, one of the eyelids is drooped. And a couple of them had them since they were really little kids. So they probably had concussions when they were little kids and nobody knew. And after the CNSR, guess what? Their eyelid went back either to normal or much better than what it was. And we've had patients whose even their eyesight has even improved. Obviously, I can't guarantee any of this because it depends what the cause is. But I've had a lot of patients that had dry eyes and their dry eyes went away. And the reason was the nerves to their eyes, they weren't hydrated enough. They didn't have enough hydration getting to their eyes through the nerves. I even had one patient who was having problems with her endodontist. Her endodontist was trying to repair her gum line and it wasn't working. And tried a couple times, didn't work. And then she came in for CNSR for some other stuff. And then she went back to her endodontist afterwards. And then he said he hadn't really seen anything like this before, because now he said she didn't need a graft because her gums had grown back. So in her case, the reason her gums were receding was because there wasn't good nerve flow to that area. And the CNSR actually opened it up and allowed it. That doesn't mean it's going to fix, receding gums. It depends what the cause is. So it really can help to align the jaw. If your cranium is collapsed in a bit on the top, your jaw can kind of wobble. And so a lot of people will have this like kind of clicky, wobbly jaw that never feels right, or can actually even get stuck or cause pain or click. And most of the time I've been finding through the year since I started actually doing this treatment and actually sending people to Dr. Mccarty, most of the time I found it's a cranial thing. Their jaw just never fit, either because they had orthodontists that did a really good job with the teeth and the bite, but ignored how the jaw actually fits and where the cranium is with the neck. Every time you swallow, your head rocks on your neck and your jaw changes position. So we swallow 2,000 plus times a day. So that can really start to, wear things down if things aren't matched up. So if we open up the cranium like this, that's obviously better oxygen, nutrients, and hydration of the brain, spinal cord, and the nerves coming out from there. Another thing it does, it can give a flat platform for your upper neck. So for years, I had these patients that I would send them to what we call upper cervical specialist chiropractors, and I still do. They can be very useful. But a lot of those cases, it's because the cranium had collapsed in. So you can think of it as you have your base of your neck here, and then you have your cranium on top, and it's supposed to basically fit right in there and then be able to turn. And if your cranium's collapsed, it's kind of going to be rounded on the bottom. And so you can think of it kind of like being a bobblehead, okay? And that was me for years. I was the bobblehead that went to chiropractor after chiropractor every week, couldn't really find a full solution. And then I had CNSR done just because I wanted to know what it felt like when I was training, and it changed my life. I don't have a problematic neck anymore. I don't have a jaw that bothers me anymore. Very helpful for me. And I have much better sinus. I don't have breathing issues at night anymore. So we're trying to restore that hydraulic system inside the cranium, around the brain. So the idea is getting that hydration, nutrients, not only through the skull, but then also down through the spinal cord. And this is where chiropractors are normally working, is basically from the neck down. And that's very helpful. It's just sometimes the problem is higher up. Sometimes it's in the cranium. And there's other good cranial techniques, cranial sacral technique and that, which I've trained in those as well. But this one I just have had I've seen results I haven't seen with the other ones. So then that, if we have a good flow down the spinal column, then that allows good flow, hydration in the nerves going out to other areas of the body. So how do I try this? Well, first of all, we need to do a full multidisciplinary exam. Okay, so that would be coming to our HOPE class. We have it the second Tuesday of every month at 6:30 here at the clinic. You can call the clinic, or you can go online to reserve a spot. Because during that exam, if we think it's appropriate, then we'll do a CNSR exam to see what's going on there. The reason we recommend going through the full multidisciplinary exam first is I had a patient a while back that he had bugged us, really good guy, but he had bugged us because he really thought he needed the CNSR therapy, and because somebody in his family had been helped. And we stuck to our guns. He came to the HOPE class, and then we did a full multidisciplinary exam on him. And guess what? We found all he needed was a specific homeopathic remedy, and his concussion symptoms were gone. So it would have been a waste of time and money to do something that the CNSR just wasn't appropriate. He didn't need it. His body just needed to be reminded how to heal the brain, is all. The whole class really helps us go over other things, other options that people might not know about. So now the CNSR here, there's different indications and contraindications to using the CNSR treatment. Orthodontics and retainers, it can be very useful. It's just we need to talk. Might want to talk through that before you decide to do the treatment, because like for me, I had all this orthodontic work, retainers, but I was done with it. And then when I had the CNSR, it actually finished off the process, aligned my teeth and my bite and my jaw and my neck and cranium the way the orthodontist, dreamed of doing. Because I had good orthodontics to start with, and I did have an orthodontist that made space for my teeth. So then it matched up with my cranium afterwards. But if people have current orthodontics and retainers, we want to talk about that, because if you have a retainer and we do CNSR, it just made that retainer not fit like it used to, because it's changing the palate shape and moving it out where it's supposed to be. If you're in orthodontics, whether it's Invisalign or braces, well, then we want to talk about that, because it is possible to work with that. It can actually bring the orthodontic time down by less than half in some cases. The catch is we would probably need to treat you almost like once a week or once every 2 weeks, depending on your case and how often they're adjusting your bite or your orthodontics. And that's just the hard thing, is it's not feasible for my practice. I can't just see patients every week. We're not really set up to do that with the timing of things. So that's something we would have to talk about. Is that a special case we try to figure out something for? I wish more doctors were trained in this kind of technique. We're working on that. So a contraindication would be any cerebral spinal fluid leak. So if somebody had a concussion and there's like a bleed in the brain, or if you've ever knew somebody that got a concussion and they have like clear sparkly fluid coming out of the ear, that's cerebral spinal fluid leaking out. Well, then that's obviously contraindicated. We don't want to do something when there's a problem like that. So if I'm concerned about somebody, I'll ask them to go in and get a medical checkup, like an MRI or a CT, specialized CT scan, to just make sure that there's no fluid or bleeding issues in the brain. If it's been quite a while since the person had the head injury or whatever, if that's why they're coming in, there's some practical things we can do to kind of check like that in the office too. So those are the only real contraindications in general. Now, follow-up treatments are flexible. You can come back the next day and do another one, or we can go up to 8 weeks out. Now, the sweet spot is every couple weeks. If we can get every 2 to 4 weeks, that's a really nice area to be for each treatment until you're done. Because once we do a treatment, it doesn't normally just go away, but it can tighten up. Like somebody that's having headaches and we treat them, we found that sometimes the headaches will go away right away, but they might come back like 6 weeks later. So we might want to get them in a little earlier than that till we get the cranium completely unlocked and they're good to go. So why CNSR? There's all kinds of reasons for CNSR. Any injuries to the head, the face, jaw pain, chronic headaches, neck. We talked about the jaw and alignment and all that. Deviated septums are big ones. Deviated septums are because there's things collapsed in there, and if we can move them out, they can become a non-issue. We've even helped people that have already had surgeries for the deviated septums and they only got so far. We were able to get it further and help them out more effectively. Chronic sinus issues, snoring, tonsils. I have some guys that their wives send them in just for snoring, and it's worked for them. But sometimes this isn't the only thing that's needed. If there's any issues with nerves to the face, eyes, and ears, we talked about, the droopy eyelids, or, vision is a possibility. Even ear sounds or problems with feeling the ears are always plugged. Even neural issues to the face can be effective at times. Definitely concussions. Concussions, I would say, are the number one, well, I would say number one, but one of the top 3 reasons for this technique is people walk around with what we call post-concussive syndrome all the time, and they just don't realize that ever since they had those head injuries or that head injury, that they've just slowly declined a bit or not functioned as well or started to have problems with their jaw or their neck or whatever. Even seen some pretty cool things with discs repairing, although that's not the main thing. We would want to talk about all the options we'd have there for that. Somebody that needs constant chiropractic, that was me. I was that bobblehead for years that went to chiropractor, and the upper cervical docs could get it, so I felt better for a while, but then it would come out again. And what I needed was the cranial part taken care of. It wasn't coming from my neck, it was coming from my cranium for me. And then emotional, hormonal, digestive issues. Sometimes that could be coming from the cranium. We have area in our brain, in the middle of our brain, kind of called the hypothalamus or thalamic areas of the brain. That controls our hormones. That also plays a big role with our emotional brain in the middle of the brain. And it also affects what we call the vagus nerve, controls the vagus nerve going down to your stomach. So that's why when people get nervous, they can get an upset stomach, okay? And so at least one of the reasons. So sometimes a person, I just had one in a while back that had a headache and digestive problems, stomach pains that wouldn't go away. And it was amazing. The very first balloon treatment we did, their headache went away and their stomach pain went away. But every case is different. Sometimes we have to get the entire cranium unlocked all the way to get any results. So that's why each case is a little different. So CNSR, the big thing we're trying to do is help the brain repair and get the nervous system working like it's supposed to from the top down. And there's so many traumatic brain injuries out there. Like I said, people are walking around with them all the time and don't realize, because the only way we can diagnose them in Western medicine or allopathy is through basically kind of like a questionnaire. And in allopathy is where most people go for concussions, which is appropriate to make sure there's no brain bleeds or anything like that going on. But then on the other hand, allopathy is the only discipline that doesn't treat concussions. All the other disciplines have ways to heal the brain, and Western medicine or allopathy, they just kind of watch it and kind of just tell you to go home and rest, when there are actually ways to actually get the brain to heal. People get mild concussions all the time where they hit their head and they have feel slightly stunned or see stars. You can have a moderate concussion where if you just don't remember the hit, that's a moderate concussion. So you remember everything around it, but you just don't remember those few seconds where you hit your head. That's an actual moderate concussion. A severe concussion is when you have full loss of consciousness. So you might be out for 30 seconds or a few minutes or whatever. That's a severe concussion. And that needs to be evaluated and hopefully treated appropriately. What are the long-term effects with chronic traumatic, what we call encephalopathy, what we call CTE? So this is an example. I borrowed this for educational purposes from a very high-level neurologist here in the Twin Cities that he teaches around the country on CTE. And what they found was, you can see like these look different, these scans. So this is a scan showing like a relatively normal brain. And this is actually a young person that has that same, it basically has the same look as like an Alzheimer's or dementia patient. And yet they're a young person that just had some multiple mild traumatic brain injuries. So what that can look like is a personality or behavior changes. I've seen that a lot with concussions. The person starts to become, if they were a little, anxious before, they might become a lot anxious. Or if they were a little angry, they might become a lot angry, things like that. Or their personality might completely change. PTSD, anxiety is very common, but there's huge increases in possibilities of depression, possibilities of OCD, obsessive compulsive, mania, schizophrenia, multiple times increase in seizure disorders. We've actually helped patients with seizure disorders with this technique, but we want to look at all the, we try to explain the whole possibility to the patients so they can make a good decision on what they want to do. Increased dementia, definitely from traumatic brain injury. And then, of course, balance and gait issues can be an issue too. So that's why we're doing this. That's one of the reasons. So the whole goal is to have options that work. That's the whole point of Hope Clinic and why we do what we do. So if you want, come out to the Hope class, sign up for that, and we can always do a CNSR exam to see if there's anything there for us to treat. Call us if you have any questions. Thanks.